I was in a motorcycle accident without a helmet on May 14, 2005. I had a traumatic brain injury and a stroke. I spent 4 months in a rehab hospital getting better.
Leeanne, who suffered a TBI resulting in neurological damage, required speech and language services following her accident. The challenges she faced as a result of her accident included difficulties with attention, short-term memory tasks, naming, and recall. Speech and language therapy helped her regain her life and perform everyday tasks. Leeanne began her journey following her accident in an acute care hospital. While in a coma, she moved to an inpatient rehabilitation hospital. Intensive 3 hours a day rehabilitation was begun. Initially, Leeanne was unable to swallow anything. Her speech pathologist provided treatment, enabling her to eat safely.
Because of the brain injury and a stroke, I had difficulty eating safely and talking. I work with a speech therapist to make my swallowing better. Now I can eat anything I want safely.
In addition, Leeanne initially presented with global aphasia, which results in difficulty with both receptive and expressive communication. The speech-language pathologist worked on following one-step directions, rebuilding vocabulary, and expressing her wants and needs, along with helping her eat and drink safely. Leeanne struggled with both speaking and writing.
Before speech therapy, I could not understand words that were talking to me. There had to be written down. I was also very hard to use words to tell people what I want or needed.
Her speech-language pathologist helped her develop strategies to communicate, such as writing what she wanted or needed, in addition to trying to speak it and keeping a planner to help her remember upcoming appointments and people. She learned to request clarification from her listeners when presented with a communication breakdown.
After speech therapy, I can understand most things without them being written down for me. And I can speak better too.
Recalling people's names or places she visited, as well as naming objects in her environment, were other areas emphasized in therapy. Leeanne's treatment began with intensive services provided several times a day. As she progressed, speech and language services provided through outpatient rehabilitation were scaled back to several times a week. Speech-language therapy provided Leeanne with the skills necessary to live successfully and enjoy life.
Now I am able to live at home by myself. I can call my family and friends on the phone. I have also been able to volunteer at Elk Rehab Hospital for the past 1.5 years. Last month, I was Volunteer of the Month.